Ladies and gentlemen, please welcome your conference moderator, Charlotte Grove.
Good morning, ladies and gentlemen. It is my pleasure to welcome each of you to the Retiree Drug Subsidy RDS Center National Conference. Before we begin, a few administrative announcements. There are facilitators located throughout the room to assist with questions and logistics. If you will look at all of the marked exits and in the front, they will raise their hand. You will know where they are. They will be your contact should anything occur during the conference that you might need immediate assistance with. Also, we will be using question and answer cards, which I will explain in a moment. And when you have those, if you will pass them to the end of the tables or at the break time and lunch time, give them to one of the facilitators. We also have two certified signers who will be up with us. They are Ken and Connie. You will see them rotate about every 30 minutes, and they will be with us today and tomorrow, as well as two additional signers in the afternoon. In your materials that many of you downloaded prior to coming, there were some changes made since you downloaded those materials. They are not major changes, so we ask you to go ahead and use them. Make your notes as appropriate, and when you go back to your home location, the new revised PowerPoint presentations will be available. There are a limited number of copies that will be outside if anyone wants to pick them up. Again, they will be available. They are not major changes so that you can download them again when you go home. We ask at this time that if you are using cell phones to please turn them to silent. This is my 4th CMS conference, and I will tell you that I have heard some very unique cell phone audio. And it's kind of like the wave. It starts at one end and it goes to the other. So if you could turn those to silent, we would appreciate it. For those of you that may need the facilities, as in the restrooms, while this conference is in place, we have a couple of options. If you go out either of the doors to your right or my left, you will find restrooms over by the children's gift shop. The men's is to the left of that gift shop, the ladies to the right of the gift shop. There are additional restrooms as you go down to my left. We've had several questions about breaks and lunch. As you can see, we do have some scheduled breaks. During the lunch, there will be in the Mexican restaurant a buffet. The Terrace Cafe, which is full service, will also have a menu available. Common Ground, which is out in the center of Atrium 1, has a deli, and there will be a remote section as well that will just have fast food, salads, kinds of things. We ask that during this conference that you keep all walkways and aisles clear. This is for your safety as well as the safety of those about you. If we see things in the walkway, one of the facilitators will very politely come and ask you to please move it, because we've had a situation in the past where there were a lot of particularly coats and things on extra chairs, so if you could work with us on that. As you know, this is a paperless conference. Many of you brought your laptops. We were able to work an agreement with the hotel that if you have your wireless card, that you will be able to get immediate access to the wireless connection. If you are having trouble getting that connection, there is an IT person. Chris, are you in the back of the room? Okay. If you have that problem, what we'll ask you to do is to take you and your laptop to the back of the room, and an appropriate individual from the IT staff will help you. There are no electrical outlets available in this room. So if you're using a laptop, be aware of your battery backup time, because there are no electricals in this area. Another thing for those of you that need to stretch at the end of the day or prior to the start of the day, the Veranda Club, which is a very nice health club facility, there is a sign-up sheet there, and that is a complimentary service. And the hours, I believe, during the week are 5:30 to 9:30, I think. And you can go over there. You will need to show your badge and sign up on the appropriate sheet that's on the front desk. In your packet, along with the programs, is the daily agenda, which also includes the biographical information of our presenters. You will also find a question and answer card that looks something like this. We use these for two reasons. Each and every question that you all have is important to us and important to those people that are not here. Time permitting, at the end of each presentation, we will take questions from the floor. In the event that we are not able to take questions from the floor, we ask that you fill out the Q&A card. If you would like to direct that question to a specific presenter, please put their name on it. At the end of the day, we will have a Q&A session that runs about an hour and a half. Throughout the day, when these cards are collected, there will be a person from the conference, actually a team, that will go through and look at these cards. Where we have duplicates, we will put those together. Then we will address as many of those at the Q&A session this afternoon. All cards, whether they were addressed here today or not, will then be keyed in to the CMS database and then uploaded to the website. That takes approximately 6 weeks. As I indicated, this is my 4th conference. We generate anything from 300 to 500 question cards in this conference. So every question is important. Tomorrow we will have 2 additional Q&A sessions, plus the one at the end of the day. So if you have those questions cards completed, you can either hold on to them until the break or the lunch, then give them to the facilitators or take them to any of the registration desks and they will take them. If you should need additional cards, we do have them, facilitators have them for you. It is now my pleasure to introduce Dr. James R. Ferris, MD, Dallas CMS Regional Administrator. Dr. Ferris graduated from the University of Texas at Austin and Howard University of Medicine in Washington, D.C. He completed his internship and residency training in internal medicine at Martin Luther King General Hospital in Los Angeles, California, and served as chief medical resident. Dr. Ferris has devoted several years to the private practice of internal medicine in Dallas. Though no longer involved in private practice, he continues to hold the positions of assistant attending physician in internal medicine at St. Paul Medical Center in Dallas and clinical assistant professor of internal medicine at the University of Texas Southwestern Medical Center. He has served as regional administrator of the Dallas office of the Centers for Medicare and Medicaid Services, CMS, since April of 1998. The Dallas office has responsibility for the Medicare and Medicaid Services, Clinical Laboratory Improvement Act, and state children's health insurance programs in the federal Region 6 states of Texas, Oklahoma, New Mexico, Arkansas, and my state, Louisiana. Additionally, Dr. Ferris leads the national CMS effort to increase influenza and pneumococcal, I'm always going to do that. I did a good job? Excellent. Immunization rates among Medicare beneficiaries and serves as the lead CMS regional administrator for rural health issues. Dr. Ferris was the recipient of the Presidential Rank Award at the meritorious level in 2002 and received the Roger W. Jones Award for Executive Leadership from American University in 2003. It is my pleasure to introduce and welcome Dr. Ferris.
Thank you very much for that kind introduction. Good morning and welcome to Dallas and welcome to the National Retiree Drug Subsidy Conference. For those of you who are unfamiliar with this part of the country, you're in for a very rare treat. You're only going to experience temperatures of 95 degrees during the time of your conference. Those of you who are from this area know that in July in Dallas, it's usually above 100 degrees and sweltering. So you're going to have a cool front over the next couple of days, and we're very pleased that we're able to provide you with that for this very auspicious conference. Dallas is very, very pleased to be able to host this meeting because of all the important information that is going to be imparted here. I want to share just a few historical facts with you. I'm a student of history, and history is my avocation, and the history of medicine is something that I find very fascinating. And many of you may already know some of these facts, but I think they will help to provide some context for the discussions that you're going to hear today. In July of 1905, 100 years ago, the average American life expectancy was only 47 years. And at the time of Medicare's inception in 1965, that life expectancy was only 68 years. Today, the average American life expectancy is 77.2 years. Yet, despite the fact that Americans are living longer, the years of healthy life are not increasing very appreciably. Many of us are going into our golden years suffering from a number of chronic, debilitating medical diseases, diseases such as heart disease, chronic lung conditions, hypertension, diabetes mellitus. Most of these diseases require management with daily medications. And we all know that the science of medicine has progressed very dramatically over the last 100 years. We now have at our disposal an armamentarium for diagnosing diseases that no one could have thought of 100 years ago. We also have medications at our disposal that are wonderful in what they are able to accomplish in helping people to stay well. Yet the cost of the technology that is involved and the cost of the research and development that are involved in providing us with the services, with the diagnostic armamentarium that we have, as well as with the pharmaceutical armamentarium that we have, that price is a rather astronomical price. So people are having to pay tremendous amounts of money for the medicines that help to keep them alive and to provide them with a reasonable quality of life. And we know that many retirees and many persons with Medicare are having to expend a significant portion of their incomes on the drugs that help to keep them alive. Now, I'm sure all of you know that in just a few days, Medicare will celebrate its 40th anniversary. The changes that were effected by the Medicare Modernization Act of 2003 are the most significant changes to the Medicare program that have ever taken place, the most significant changes in 40 years. One of these changes is the establishment of the Retiree Drug Subsidy. On today and tomorrow, this conference will provide you with information about the Retiree Drug Subsidy. And to start this conference, we're going to have the CMS Administrator, Dr. Mark McClellan, who is also a physician and a PhD economist who understands medicine from the perspective of the physician, who also understands the economic side of the provision of good healthcare services. Dr. McClellan is going to have a few words to start this meeting for you. So I want to take this opportunity to thank you for your interest in this subject, to thank you for your participation in this conference, and now I will ask you to direct your attention to the screens for the message from Dr. McClellan. Thank you.
Welcome to the National Retiree Drug Subsidy Conference. It's a real pleasure to join you here today as we take important steps together to help secure the retiree drug coverage that many Medicare beneficiaries depend on. The Medicare Modernization Act established a retiree drug subsidy program to encourage employers and unions to continue providing high-quality drug coverage for their retirees and to enable them to do it at a lower cost. On January 1st, 2006, Medicare will start providing financial support in the form of a subsidy to employers and unions that offer prescription drug benefits to their retirees. The Retiree Drug Subsidy has flexible rules that permit employers and unions to continue providing drug coverage to their Medicare-eligible retirees at a lower cost while retaining their current plan designs, the designs that have worked well for their employees' particular needs. The Retiree Drug Subsidy offers significant advantages to plan sponsors and unions offering prescription drug benefits to retirees. It's available to all employers and unions, regardless of whether they pay taxes or are tax exempt. It provides employers and unions with plan design flexibility and allows them to use the vendors of their choice. For employer and union plan sponsors that are contributing to retiree drug costs, the Retiree Drug Subsidy will directly reduce these costs with limited administrative burden. Plans can operate on a calendar year or non-calendar year basis and still receive the subsidy. CMS has created a streamlined process for employer and union plan sponsors to qualify for and to receive the retiree subsidy. The primary steps in this retiree drug subsidy process include: first, submit an application by September 30th, 2005 to qualify for the retiree drug subsidy beginning on January 1st of 2006. Second, attach to the application an actuary's attestation that the plan meets the actuarial equivalence standard. Third, certify that the creditable coverage status of the plan has or will be disclosed to plan participants and to CMS. Fourth, electronically submit enrollment information about retirees and dependents. And fifth, electronically submit aggregate data about drug costs incurred and reconcile these costs at the end of the year. Along with a general overview of the Retiree Drug Subsidy Program, this two-day conference is structured to give you specific operational information and assistance through presentations focused on various retiree subsidy issues. We will introduce you to the RDS Center, which was created by CMS to be a comprehensive one-stop resource for plan sponsors. Over the next 2 days, we will review the technical issues associated with the retiree subsidy process. We'll provide a review of the drug subsidy paperless application that's available online through the RDS Center website. This conference will also provide you with an overview of how data are sent and received, and of user roles in audits and reconciliations. Research tells us that as many as 10 million retirees and dependents may take advantage of prescription drug benefits from employer and union plans that use the Retiree Drug Subsidy. So it's very important that every employer and union communicate clearly and consistently to their retirees about the Medicare prescription drug coverage program and when it goes into effect. We are counting on working with employers and unions to help ensure that retirees and dependents know what they need to do to take advantage of this new help, that they can confidently make decisions before the Medicare prescription drug coverage program goes into effect on January 1st, 2006. So we need help in explaining how this program works in relation to Medicare, how your employer and union prescription drug plan are taking advantage of this new help from the Medicare program to continue to provide high-quality drug coverage to retirees. We're counting on plan sponsors to help us spell out to retirees and their dependents the decisions that each beneficiary needs to make to take advantage of this new help. This means we need to strive for educating not only current retirees and those soon to be eligible for retiree coverage, but also other workers who, as adult children of Medicare beneficiaries, will be helping their parents make choices about taking advantage of the new help from Medicare. We know you have some big decisions to make in the months ahead. We know, too, that how you make these decisions can have important positive benefits for millions of retirees, and so we stand ready to help in any way we can. We hope you'll let us begin by answering your questions about how to apply for the retiree subsidy and your other options, and how to educate your retirees about the changes that are coming with the new help from Medicare. We already have a number of resources available to assist you in doing just that. CMS is working with employer groups through conferences like this one to help ensure that employers and unions will have the information they need to perform major outreach activities to their retirees before October 2005. CMS has resources on our website to assist employers and unions in communicating consistently and clearly and effectively to beneficiaries. We want every beneficiary to be able to take advantage of this new coverage, and with the assistance of employers and unions, we're confident that beneficiaries will make the decisions they need to make on a timely basis to use the new retiree subsidy help. Thank you very much for attending this conference and your efforts to continue to provide help for retirees with their drug costs. I know you'll find the overview of the retiree subsidy program and the specific technical issues that will be addressed in this conference of considerable value. Enjoy the conference, and again, it's a pleasure to be with you.
Even though he's not here, we thank Dr. McClellan for his comments, and also Dr. Ferris. Our next presentation is the introduction to the RDS program. We will have two presenters, Mark Hammelberg and David Gardner. I'd like to introduce each of them individually first. Mark Hammelberg is the Director, Employer Policy and Operations Group, Centers for Medicare and Medicaid Services. Effective October the 18th, 2004, Mark Hammelberg joined the Centers for Medicare and Medicaid Services, CMS, as the Director of Employer Policy and Operations Group. Prior to joining CMS, Mark was an attorney and a principal in the Washington Resource Group of Mercer Human Resource Consulting. While at Mercer, Mark advised consultants and clients on a broad range of tax, ERISA, and other compliance issues affecting employer-provided health and welfare benefits. His primary focus in recent years has been retiree medical coverage, including Medicare and tax code pre-funding rules, along with HSAs and HRAs and other new benefit designs. Previously, Mark was an attorney advisor in the Office of Benefits Tax Counsel, U.S. Treasury Department, where he was one of the principal authors of the HIPPA portability regulations, and an attorney with the law firm of Lee, Toomey, and Kent, where he counseled clients on a wide range of tax and ERISA issues related to employee benefits. David E. Gardner is the Senior Technical Advisor, Retiree Drug Subsidy Operations, Centers for Medicare and Medicaid Services. Dave is the Senior Technical Advisor for RDS Operations with the Employer Policy and Operations Group within the Centers for Medicaid and Medicare Services. He is responsible for establishing the operations of the RDS program. Dave has over 13 years of Medicare operations experience, including project management responsibilities in the areas of coordination of benefits, fraud detection and prevention, information systems development, program evaluation, quality improvement, and budget information. It is my pleasure to welcome both gentlemen.
Thank you. Thank you. I get to go first. Well, I want to join Dr. McClellan and Dr. Ferris in welcoming you today. As I look out, this is just great. When I started CMS in October of 2004, we always envisioned we'd get to this point, but seeing us get here is still incredibly gratifying, to be honest. Dr. McClellan summarized the key elements of the drug subsidy rules from our perspective, that they provide what we think is great flexibility to sponsors to qualify for the subsidy, and to do so without incurring significant administrative burden. And speaking of those rules, one quick personal observation about it. Now, I think many of you know that the MMA established a number of the requirements relating to the subsidy, but they also left a lot of blanks. They left a lot of decisions for CMS to make to fill in those blanks. And I have to tell you, I'm very, very proud of the tremendous effort that the team at CMS and the contractors that we've worked with have put in to produce these rules that I think, again, are administratively flexible, are flexible and not administratively burdensome, and to do so in really just an incredibly short time frame. Now, over the course of the next couple of days, you'll meet many of the people from CMS that have been involved in producing those rules and the contractors from the vendors that have been helping us. But before I go on, I also want to acknowledge you folks in the audience, because many of you here are really part of the reason that we're here today. You've provided insightful comments on the proposed rules. You've given us other input in many other areas through phone conferences, through live events. All of that was incredibly important in producing what I think will be workable rules on a going forward basis. So on behalf of CMS, I want to thank you for everything you've done to help us get to this point. Now, over the course of the next 2 days, I promise we'll start drilling down very quickly into the nuts and bolts, into the operational aspects of these rules. So hopefully, when you walk away from here on Wednesday night, you'll have a much better sense, if you don't already, of exactly what you need to do to successfully apply for the retiree drug subsidy. Now, before going there, just a couple of very quick points I would like you to keep in mind as we go through the next couple of days. First, as any of you have heard me speak at other conferences, you know I always try to remind people about the context in which the retiree drug subsidy was created, because we always have to remember that, I think. There's been a significant erosion in retiree coverage over more than a decade. And then when the MMA created the new Medicare prescription drug benefit that will be starting in 2006, serious concerns were raised about whether that benefit might somehow cause a further erosion in retiree coverage. And it's for that reason that the MMA, focusing on retiree coverage, created the incentives, the financial support that will be available to employers on a going forward basis to encourage them to keep offering retiree coverage. Now, these will reduce employer costs, and we're very gratified to know through more formal surveys and through discussions with many of the people here today that the financial incentives are doing precisely that, that they are in fact encouraging employers to keep offering the good high-quality prescription drug coverage that they've been offering to retirees before. It's also important, I think, as we talk through a lot of these details, to keep in mind what I think are the absolutely essential parts of the subsidy, because many of you here today probably already know a lot of the details. When you're talking to other people, when you're talking to clients, if you're an advisor, it's always, I think, important to always remember the basics. It provides employers and unions a direct, tax-free 28% subsidy payment for providing prescription drug coverage. It covers allowable drug costs, which essentially are outpatient prescription drug expenses, and it covers qualified covered retirees, people who are eligible for the new Medicare drug benefit but choose not to take it. Now, of course, again, many of you probably are aware that there are other options under the MMA for employers and unions sponsoring coverage. They generally involve retirees getting some benefits from these new Medicare Part D plans in some fashion, with the employers providing supplemental coverage. But all the surveys so far suggest that by far the most popular option, particularly for 2006, is the retiree drug subsidy. Now, before I turn the mic over to Dave, I want to just reiterate one thing that Dr. McClellan was mentioning. It has to do with educating your retirees about all of this. The retirees will need information going forward so they can make informed decisions about what to do. I suspect that most are going to want to stick with their good, high-quality retiree coverage, but some might be tempted to drop it in favor of the Part D benefit, and some actually might want to do both. And they need to know what options will be available to them under the employer and union coverage. And this could be especially tricky for some people, like low-income people, for example, who will be getting financial assistance for buying Medicare Part D plans. In some cases, in fact, in perhaps many cases, it might actually benefit everybody, the retirees and the sponsors, to have those people go and get prescription drug coverage from a Medicare Part D plan and get supplemental non-drug coverage from the sponsor. But in any case, everyone needs to know what's permitted and how it's going to work. And since it's not too long removed from when I was actually, I'd be somebody sitting on down there with you listening to somebody like me talking, you folks are on the front lines. Employers and unions and their advisors are on the front lines. You know your plans best. You know your retirees best. And the questions will be coming to you. So, in terms of your own self-interest and also in terms of what's doing right, communicating early and often with your retirees will reduce confusion, will reduce your workload, and make everybody, I think, make the best informed decisions they can make. And over the next 2 days, when I'm wandering around out there, I would very much like to continue the dialogue so we can understand how you expect to communicate to your retirees, when you're going to do it, and to talk about ways that CMS can partner with you to make sure that they get the information that they need. So thanks again for attending the conference. I know that you will find it useful in this, what's personally for me, and I think for many of you, an incredibly exciting time as we're right at the cusp of implementing the Retiree Drug Subsidy Program. Thank you, and I'm going to turn it over to Dave. Thank you.
Good morning. It is really exciting to look out and see this many people here today. It's been a lot of hard work over the past few months, and really looking forward to meeting and speaking with many of you, the smiling partners and customers in the audience. Some of you are smiling anyway. Today and tomorrow are truly going to be training days. We promise to give you what you need to know in order to hit the ground running on August 1st, the first day that the RDS Center secure website and online application will become available. We have a lot of material to get through, and much of it will be pretty technical. However, we promise to try and just have a little bit of fun while we're doing it. I'd like to take just a couple of minutes to give you some brief background on what's been going on since last November to establish the RDS operations. The journey towards the launch of the RDS program started for me not too long ago. Again, it was back in November, and that's when I first met Brenda Tranquita and Mark Hamelberg, the directors of the Employer Policy and Operations Group. I accepted their offer to take on a new challenge, working in their rapidly growing group. And my job, simply put, was, as they put it at the time, to become the EPOG ops guy. And I thought that was great. You know, I'm working in a new office and with a lot of new people, great people, and with important things to work on. And bonus, they had already given me a nickname, so I thought that was pretty cool. I was excited, and I went home that night, and my wife and I went out to a really expensive dinner, so I spent the promotion already. But we celebrated. We had a good time. Was really looking forward to what was before me. Came in the next week, ready to get to work, fully caffeinated, sitting comfortably at my desk at 8:30, and started jotting down some notes about what I thought the major operations milestones were going to be over the next year in order for us to hit our target of going live on January 1st of 2006. Then I grabbed my calendar and started doing some math with the program implementation timeline. Then it happened. I had one of those moments where you'd swear the temperature in the room went up about 50 degrees like that. All the air left the room, and I had what I've called before a slow motion moment where everything just seems to stop. And in that moment of panic, I realized the enormity of what had to be accomplished in the coming months. And the challenges were as follows. Number one, in less than a week, I personally had to get up to speed on the MMA law, regulations, establishing the RDS program so that I could put the finishing touches on what was almost a 200-page RDS Center scope of work document that was supposed to go out for bid the following week. I thought, okay, I can read, no problem. But thankfully, I also had on my side the help and patience of Jim Mayhew and Kathy Winfield Jones. I'm not sure where Kathy is. She's probably working hard in the back. Brian Maloney, Mark, and Brenda, and we got the materials out on time for the bid in late November. Challenge number 2. In fewer than 55 work days, we had to procure the services of a vendor that would help CMS administer the RDS program as the RDS Center. And while I thought the schedule seemed very aggressive, given the level of interest and the internal clearances that were required for this complex program. But rising to the occasion, the RDS procurement team kicked it up a notch, and we awarded the RDS Center contract on February 17th. I'd like to publicly thank John Albert, Brian Maloney, Aaron Wesolowski, and George Wilson, who are on that procurement team, for working so hard over the holiday season when so many other people had gone off to take a few weeks of rest. We were working hard, and the end result is we kicked it up a notch, as I said, and we hit the contract award milestone. Then came big challenge number 3, the biggest challenge of them all, which is in less than 20 weeks, just 100 work days. 100 work days. It's not that much. We had to rapidly implement the RDS Center. To do so, we had to build the physical infrastructure, which included a secure data center, and a staff of almost, well, I guess more than 50, now that I think about it, more than 50 people, all of them experts in their own regard. And we had to establish the RDS call center. That's up and running. We had to begin publicizing and hosting outreach events just like this. And most significantly, we had to build, test, and implement a secure internet-facing environment that would allow CMS to share information with the public and to transfer sensitive data back and forth with our RDS customers and partners in ways that CMS, frankly, has never done before or attempted to do before in Medicare on a national scale. A one-stop shop, flexible, highly secure, and I emphasize that, highly secure, available 24 hours a day, 7 days a week, innovative and paperless, easy to explain, easy to use. This is the vision of the RDS Center website. Easy, flexible. You've heard these words from CMS senior management here this morning. The words truly echo in the CMS hallways and the RDS Center hallways every day. It comes up in every third conversation, I think. Plan sponsors, benefit administrators, insurers, actuaries, and consultants. It's our commitment to you to deliver this important federal program in line with these principles of being easy and flexible. CMS has long been a health insurance industry leader in the use of technology to implement programs. And by implementing this RDS Center website, we are continuing that tradition. We've borrowed best practices from some of the online services you've probably grown to love and use on an almost daily basis. And I believe firmly, once the RDS website is complete, that we will have raised the bar, particularly with respect to information security. Now I'd like to introduce you to the RDS Center team, who's been working tirelessly and practically around the clock since February to deliver what you'll be seeing and hearing during this conference and in the coming months as the RDS program takes off. VIPS, spelled V-I-P-S, is the prime contractor for the RDS Center. VIPS is a leader in developing innovative system solutions in the healthcare industry and has over 25 years of experience serving commercial and government clients, including CMS. The team also includes subcontractors, Arkansas Blue Cross Blue Shield, Group Health Incorporated, and Northrop Grumman. Arkansas Blue Cross Blue Shield is an expert in Medicare operations, and they've been a Medicare fiscal intermediary and carrier since the early days of Medicare. Group Health Incorporated, based in New York City, has been a Medicare carrier since 1966. They're also Medicare's Coordination of Benefits contractor. And last but not least, Northrop Grumman. They're a premier provider of IT services and development and network security services in the healthcare and other industries. I'd like to personally thank the VIP's program director, Gary Calabrese, and their IT director, Pat Ambrose. They've put up with me for countless hours over the past 5 months, and I've demanded a lot, quite a lot, and they've responded with a level of commitment, the likes of which are pretty hard to find. So I thank you. And their commitment is very contagious, and it's clearly reflected in the staff that they've brought on board. Finally, I'd like to thank the members of the CMS Ops team, Brian Maloney, Jim Mayhew, Jim Crawl, Kathy Winfield-Jones, Sonia Brown, and Joseph Hefter. Your hard work and support keep me going, guys, and I truly appreciate it. It's been quite a challenge over the last few months, and we've all worked very, very hard. It's just great to see this day finally come. All right, I guess it's time to move on down the agenda. Let's get started, and I'll turn the podium back over to Charlotte. Thank you.
To Mark and to David, thank you very much. As I indicated earlier on, this is my 4th CMS conference, and I have watched such enthusiasm over the months that I've been involved with it. I'll tell you, the first one we did was in Baltimore in January, and that was quite the challenge, along with, I'm not sure how many inches of snow we had in one day, but now to be here in this fine state of Texas. I always call Dallas, you know, the state because it's so big. But I love Dallas, and it's nice to be here and to see all of this hard work happening. Our next presenter is Jim Mayhew. He is going to address RDS application content overview. Jim is the Health Insurance Specialist and Technical Advisor, CMS. Jim is a health insurance specialist and technical advisor with the Employer Policy and Operations Group of CMS. He was a key member of the team that wrote the retiree drug subsidy provision of the MMA Title I Final Rule. He currently is working on policy for the retiree drug subsidy provision and other employee options under MMA. He previously was the project officer of the High-Risk Pool Grant Program and worked on implementation of health insurance reform under HIPAA. Before coming to CMS in 1999, Jim practiced law as a legal aid attorney in Baltimore, Maryland. He received a JD degree from the University of Baltimore, Maryland Law School. It is my pleasure to welcome Jim Mayhew.
Good morning. It's good to be here. Nice looking audience. You know, the number of phone calls I've received in the last year, I bet I've talked to every one of you at least once over the phone. And as Mark said, we really welcome those phone calls, we welcome those input, and I hope to continue that dialogue throughout this conference. And I hope to meet a lot of you in the hallway so we can just continue to discuss how we're going to make this a excellent program, and we're well on our way because of the input we've received so far. Now, I've worked on the policy side of the Employer Policy and Operations Group, and I was one of the team members that wrote the regulation for the retiree drug subsidy. So what I want to open up with is to give you an overview, high-level, brief overview of the application, and then and give you some of the policy reasons why we developed the application the way we did. And then after my presentation, we'll really get down to the nuts and bolts of the how to do the application. Okay, we had some overall policy goals when we started to work on the application, and this was our policy goals when we developed the regulations as well. You've heard Dr. McClellan and Mark Hamelberg and Dave talk about the first policy goal already, and that is to keep the process simple, keep the application process simple, and as least burdensome as possible to the plan sponsors. And I think the policy reason behind this is because we want to see the sponsors get the retiree drug subsidy. We want to see the sponsors to continue to provide good, high-quality coverage to their retirees. And so by keeping the process simple, it's a way of encouraging the plan sponsor to apply for the retiree drug subsidy. And also, by keeping it simple, we keep the cost down for both the sponsors and the government. The second goal was to keep it flexible. As all of you know, it's a very complex environment in which sponsors are providing retiree drug coverage and health coverage. There's a wide variety of plan structures and plan designs out there, and so we have to accommodate that complexity. And so the best way to do that is to make the application flexible to accommodate the wide variety of designs. And the third and very important goal is to keep the process secured. We want the plan sponsors to apply with the peace of mind knowing that the data that they submit will only be used for one purpose, that is to determine their eligibility for the retiree drug subsidy program. And also with the assurance that the people, the personnel in the RDS Center and CMS are only going to use it for that purpose, and it's not going to go anywhere else. And the fourth policy goal is obviously we have to comply with the regulations. We have to obtain the required information to make an accurate determination as to the plan sponsor's eligibility for the retiree drug subsidy. Now, those requirements that I just spoke of are enumerated in the federal regulation, 42 CFR 423.884. And that lays out what has to be in the application and also lays out what has to be in the actuarial attestation. So this regulation is our Bible, so to speak, in developing the application because this is the information that we have to obtain in order to determine eligibility. And as most of you already know, the application will have to be submitted electronically. We want to make this a paperless process, and we will be talking a lot more about that down the road. Now, one of the main points to make when we talk about the application process is that we're going to accept one application per plan. And then, of course, the underlying issue with this point is, well, what is a plan? And basically, it's going to be, as all of you know, this is a very complex issue. And, you know, it all really boils down to how the plan sponsor administers their benefits. You may have one plan sponsor who administers all the health benefits under one plan. Well, then they submit one application. You might have a second plan sponsor who provides similar benefits, but they administer it as two plans. Well, then they provide two applications. So simply, one of the main issues here, one of the main points to make is just one application per plan. Now, as we've been saying all along, we've been making clear what the deadlines are, and I'd like to just go over those really quickly. The deadline to apply for the subsidy in 2006 is September 30th of 2005. The application will be online on August the 1st of 2005. There will be an opportunity to apply for a 30-day extension, but that request for the extension must be submitted before the deadline, September 30th. And then for years 2007 and beyond, the deadline will be, application deadline will be at least, has to be submitted at least 90 days before the start of the plan year. And again, there'll be opportunity to request a 30-day extension for those years as well. Now, the application went through we posted a draft application in the Federal Register on June the 3rd to go through the Paperwork Reduction Act clearance process. And the comment period ended on July 3rd. And we received several very good constructive comments about the application. And we will be just doing some really minor changes to the application as a result. So what you're seeing today is all current and all very relevant. We're just going to make just minor changes to the application as a result of the comment. Now, there are 7 parts to the application, and I'd just like to go through each part very briefly and maybe explain what were some of the policy rationale as to why we developed each part. Part 1 is the general contact information. This is the general information of the plan sponsor. The plan sponsor, name, address, and EIN number. That EIN number will be used for validation purposes. When the plan sponsor submits an EIN number, we will validate that number against the database. And then they'll have to name the various people who will be assisting with the application, the account manager, authorized representative, and other application designees. We will be getting into the various roles, the various functions of those roles later this morning, so I won't go into those at this point. Now, and the reason this is part 1, the reason for this part, obviously, is that the plan sponsor is the applicant. The plan sponsor is the one that's ultimately responsible for the information in the application, and the plan sponsor is the one that will receive the subsidy. One question I've gotten throughout this whole process is, who did the subsidy go to? Well, the regulations and the statute make it clear it is the plan sponsor that gets the subsidy. And therefore, that's the way the system's set up, is that the plan sponsor will be the one that gets paid the subsidy. Now, barring any kind of internal rule for the plan sponsor, a union agreement or a trust agreement or whatever, the plan sponsor is free to do whatever they want with that money, and if they need to pass it on to the vendors, they're free to do that. But from a CMS standpoint, it was the plan sponsor that's the one that's going to be paid. Okay, part 2 is where the plan sponsor will provide their information on the benefits that they're providing to the retirees, and these are the benefits, the coverage that they believe is eligible for the retiree drug subsidy. And again, this section is really set up to accommodate the wide variance in plan designs and in complexities. And basically, it's set up for the plan sponsors to provide the information for each benefit option within their plan. And this is done for a couple of reasons. First, the actual equivalent attestation requires that each benefit option separately meet the gross test. So, so the benefits have to be enumerated by particular benefit option. And all options must be within the same plan year. All options within the plan must be within the same plan year. And another important point to make is that you only name the benefit option within the plan. For the purposes of the actual equivalent attestation, the net test, you can only aggregate the benefit options within the plan. You cannot combine benefit options outside the plan to the benefit options within the plan. You're going to be naming the benefit options within that plan. Now, the definition of a benefit option, we define a benefit option in the regulation, and that's defined as a particular benefit design, category of benefits, or cost-sharing arrangements offered within a group health plan. And so the sponsors have a lot of flexibility in defining what is a benefit option within the plan. But again, it has to be within the group health plan. As part of Part 2, the plan sponsor must designate an actuary that's going to do the attestation for the benefit options. They must provide the actuary's name and contact number, and also the American Academy of Actuaries membership number. CMS was working with the American Academy of Actuaries to set up to assign membership numbers to all the actuaries that will participate in the RDS application. And so in order to do the attestation on the application, the actuary is going to have to provide the membership number. Now, Part 3 is a critical part of the application. It's the attestation of actuarial equivalence. The requirements of this are clearly designated, spelled out in the regulations under 823, 884. And this is set up, when we set this up, we recognize, again, the complexity of the arrangements, and that we recognize that sponsors may have different actuaries do the attestation for different benefit options. For example, you might have a sponsor with a self-funded PPO plan, and then they have a fully insured option. They may have their own actuary do the attestation for the self-funded plan, but then have the insurance company of actuaries do the attestation for the fully insured plan. So again, we recognize that there may be more than one actuary involved in the attestation of the plan. Now, if the as for the attestation, each benefit option must be attested separately for the gross value test. And then once they pass the gross value test, the plan sponsor has the option of aggregating those options for the net test. And so if the benefit option is on a standalone basis, in other words, it's not going to be aggregated for the net test, then you can have the same actuary attest to both the gross and net value of that particular benefit option. But if you're going to aggregate the options for the net test, then you must have one actuary do the attestation for the combined options on the net test. And the plan sponsor will have to designate whether or not they're combining the benefit options on the application. Now, as far as the actuary is concerned, they will not have to submit any work papers with the application. They just certify the attestation, complete the certification, but they must maintain their work papers for audits, and the regulations require that they must be maintained for at least 6 years, with the potential of extending that time if CMS and the OIG have the right to extend that retention period. Okay, Part 4 is the electronic fund transfer information. And as I said, this is going to be a paperless process. There will be no paper checks. We only pay electronically. that the plan sponsor is going to have to designate where the money is going to go, and they have to sign the authorization for payment into the bank account. So this is a critical part of the application, because if you don't fill this out, you don't get paid. Okay, part 5 is where the sponsor has to designate the payment frequency. And again, this is one of the more flexible aspects of the application, in that the sponsor has the discretion to choose, has the option to choose either a monthly, quarterly, interim-annual, or annual payment. And I get a lot of questions about what's the difference between an interim-annual and an annual payment. Well, they're both based on a one-time payment based on a cost incurred annually. But the interim annual is at the end of the plan year. The sponsor will submit the interim cost data plus the estimated rebate amount, and they will get an interim payment as soon as they submit that information. But then within 15 months after the plan year, they have to go through the reconciliation process, just like the monthly and quarterly option, where they submit the actual rebate data and the final cost data, and that payment will be reconciled. If for just the annual, you don't bother with the interim process. You just wait until you get all the actual rebate data, and you submit the final cost data within 15 months after the end of the plan year, and you just get that one-time payment. To be honest, when we first drafted the regulations, we did not have an interim annual option in there, but that was suggested by OMB. We thought it was a good suggestion, so we put it in there. Okay, part 6 is the retiree list submission. This is where the plan sponsor will submit who may believe are the qualifying covered retirees for whom they'll be able to collect the subsidy. A qualifying covered retiree is someone who is Medicare eligible to enroll in Part D, but does not enroll in Part D, and does not have current employment status. It was simply retired or disabled. And what will happen is the plan sponsor will submit the list, the CMS, through these various transmittal methods. And we will explain that in a little while, so we're not going to go into that here. But then CMS will send a response file letting the plan sponsors know which of the qualifying covered retirees matched up against the Medicare beneficiary database, and which ones are eligible to be counted for the subsidy. The retiree list will have to be updated monthly through additions, changes, and deletes, and there'll be a lot more on that later. Now, the regulations require that on the retiree list submission there be certain data elements for each retiree. What's enumerated in the regulations is on this slide: the full name, date of birth, sex, Social Security, or HIC number, and relationship to the participant. If you have both the Social Security and the HIC number, we'd ask that you provide both, because by having both, reduces the error rate. In addition, we'll be requiring several other data elements for the retirees. We'll be getting that more on that later, but basically those data elements are the plan sponsor ID, application ID, benefit option identifier, which benefit option the retiree is in, and the effective and termination date of the retiree coverage for that particular plan year of the sponsor's plan. Part 7, last but not least, did the plan sponsor agreement. And this has to be signed by the authorized representative. And the authorized representative will certify that the information provided is true and accurate and complete to the best of his or her knowledge and belief. This agreement also includes the certification that they have required, they have provided or will provide the certificates of creditable coverage to the retirees in the plan. And it includes the agreement to maintain protected health information, maintain it according with the privacy standard, HIPAA standards, and a couple other provisions in there. Okay, well that completes my high-level overview of the application. From here on out, we'll be really getting down to the details. So I hope that this was helpful, and I hope that this walkthrough that's coming up will be very helpful. And I will also be on the panel following Pat's presentation for questions and answers. And feel free to pull me aside in the hallway if you have any more questions. Thank you very much.
Thank you, Jim. Thank you to Dr. Ferris, Mark Himmelberg, David Gardner, and to Jim Mayhew for starting our program off. We are going to take a 5-minute transition break because we're bringing a team up that's going to be interactive with the laptop computer up here. So as these gentlemen exit, our next panel will come up. So stand up, take a stretch break, and this is not the official break. This is just a stretch break.
Out of the tree of life, I just picked me a plum. You came along and everything started in to hum. Still, it's a real good bet, the best is yet to come. Best is yet to come, and babe, won't that be fine? You think you've seen the sun, but you ain't seen it shine. Wait till the warm-up's underway. Wait till our lips have met. And wait till you see that sunshine day. You ain't seen nothing yet. The best is yet to come, and babe, won't it be fine? Best is yet to come, come the day you're mine. Come the day you're mine. I'm gonna teach you to fly. We've only tasted the wine. We're gonna drain the cup dry. Wait till your charms are ripe for these arms to surround. You think you've flown before, but baby, you ain't left the ground. Wait till you're locked in my embrace. Wait till I draw you near. Wait till you see that sunshine place. Ain't nothing like it here. The best is yet to come, and babe, won't it be fine? The best is yet to come, come the day you're mine. Come the day you're mine, and you're gonna be mine. doesn't come late. She'd never bother with anyone she'd hate. That's why the lady is a tramp. Doesn't like dice games with barons and earls. Won't go to Harlem dressed in ermine and pearls. Will not dish the dirt with the rest of those girls. And that's why this chick is a tramp. She loves the free, cool wind in her hair. Life without care. She's broke, but it's hope. Doesn't like California. It's cold and it's damp. That's why the lady is a tramp. She gets far too hungry, babe. Wait there for dinner at 8. She adores the theater, however doesn't get there late. She'd never bother with someone she'd hate. That is why the lady is a tramp. Doesn't like dice games with barons and earls. Never makes a trip up to Harlem driving shiny Lincolns and Fords. She won't dish the dirt with the rest of those broads. That's why this chick is a tramp. She loves the free, fine, wild, knocked out, cuckoo, groovy wind in her hair. Life's without a care. She's broke, but it's hope. She loathes California. It's cold and it's damp. That's why the lady, that is why the lady, that's why lady is a tramp. Start spreading the news. I'm leaving today. I want to be part of it. New York, New York. These vagabond shoes are longing to stray right through the very heart of it. New York, New York. I want to wake up in a city that doesn't sleep and find I'm king of the hill, top of the heap. These little town blues are melting away.
Ladies and gentlemen, if you'll take your seats, please. A couple of housekeeping issues, if I may. If you have questions on your cards, if you would pass them to the end of the row, either end is fine. A facilitator will come and pick them up. We are going to, at the break, put additional forms out. There was a comment this morning about having access to the room without a badge. Originally, we were informed that for security reasons that a badge was required to enter the room. That has since been modified due to the lines and the elevator issues. We would like to see everyone have their badges because there are other conferences going on. However, we have changed that. I know that a couple of you, our facilitators, were briefed to make sure that everyone had that badge. Again, for security, that's been modified. So facilitators, if someone comes in without a badge, please let them come in and have a seat. We also know that many of you already have questions. We've received several. We will address those this afternoon at the Q&A session. Our next panel is interacting with the RDS Center using the secure website. It is a three-person panel: Pat Ambrose, Dave Gardner, and John Albert. Patricia Ambrose is the Retiree Drug Subsidy IT Director, Government Services Group, VIPS Incorporated. She has been a VIPS employee since October of 1990. She has 20 years of experience in developing, maintaining, installing, and managing large-scale data processing systems on a variety of technology platforms. In her time at VIPS, she has gained extensive knowledge and experience in Medicare and CMS systems and data from both technical and business perspectives. Through her work with the VIPS Medicare system, VMS, Medicare Coordination of Benefits, COB system, and other related systems. She also had responsibility for development, installation, and customer service associated with some of VIP's commercial software products. Pat is responsible for all IT-related tasks for the RDS Center. Prior to coming to VIPS, Pat taught secondary mathematics and biology and spent some time working in a property casualty actuarial department projecting loss reserves. A returning panel member is Jim Gardner. Jim, would you like me to read that auspicious introduction again? Dave Gardner. See, I forgot already. I just wanted to see if he knew because he's up here all day. So we kind of test him every once in a while to make sure he's awake, and he's doing a good job. John Albert is the technical advisor for CMS. He has worked there for 16 years. For the past 13 years, he has worked exclusively on both prepayment and postpayment Medicare secondary payer operational and policy issues. He currently serves as technical advisor in the Office of Financial Management, assisting in the administration of the Medicare Coordination of Benefits contractor. He serves as the government task leader for a team responsible for the IRS, SSA, CMS Data Match Project and the Voluntary Data Sharing Agreement Project, both of which are administered by the Medicare COB contractor. It is my pleasure to welcome this team.
Thank you. My name is Pat Ambrose, and as was said, I am responsible for all the IT activity on RDS. It is a challenging project, as Dave said. We're under a rapid development schedule, and then I get to come and present in front of 800 people too, to add to the stress. But we're doing a great job. I have a great, yeah, I'm okay. I really have a great team. They're back mostly in Baltimore. Some are located in other parts of the country, but I really couldn't afford to take them offline. You'll meet Joanne Sosnock tomorrow, who is one of my managers, but everyone else is back working hard to get this system up and running, the application process ready for you August 1st.
As they should be.
Yeah. So I am actually going to get into the detail, into the weeds, as they say, show you actual screens, pages of the secure website that you will see and interact with. This is just a demo. It's not a live demo. I'm not interacting with the database or the actual system behind it. So bear with me in that there might be a few moments that it's not absolutely smooth. At any rate, though, I will show you the basics of what you will go through when you come to the RDS Secure website. This is where you will come to establish your plan sponsor account, register and apply for a login ID, and complete your application. Also note, as far as the demo goes, there may be some minor changes to the pages prior to implementation on August 1st. I actually am not showing you absolutely everything today. I think I'll torture you with enough detail. I'm going to switch back and forth between the PowerPoint presentation and then the website pages on my laptop. So I'm going to have to give signals to our AV crew in order to do that. And again, just bear with us for those clumsy moments that might come up. I really do look forward to your questions and your feedback. It's not frequent with an internet-facing application that we actually can be face-to-face with our end users. And I'd like your feedback throughout this session, but then also ongoing. Please don't hesitate to provide us feedback on the website functionality, suggestions for improvement. We are under, as I said, a rapid development schedule. So we will be rolling out functionality in phases, and I encourage you to continue to provide your feedback going forward. As has already been presented this morning, this is your primary communication link with the RDS Center. Come to the RDS website and log into the secure website and submit your application, retiree files, your payment requests, appeals, requests for extensions. This is where you'll maintain your plan sponsor account information and track status and receive notifications back from the RDS Center. We are attempting to make this a completely paperless system as much as possible. We'll make a great deal of use of email for certain notifications, and you'll see that throughout the presentation. So you'll be providing us with your email address as a user of the website, and we will be communicating back certain information to you from time to time, mainly to request that you come back to the website to view certain information, notifications, that sort of thing. I'm now going to spend a little bit of time talking about the various people or roles that will be present on the website. The first is the authorized representative. This is your business owner or trustee of the plan, the person who is ultimately accountable for the accuracy of the application, data submitted, payment requests down the road. The only person who is able to actually sign and certify the plan sponsor agreement. And in order to represent some of these roles, I decided to bring some props here and torture my task leader here. So I'm going to use a crown to represent the authorized representative, and I actually had two, and he chose this one, believe it or not. Anyway, paybacks, Dave.
It's great. No, it's great.
Okay, so I'm using these hats to represent the roles, and Dave's going to be my Vanna White here and actually demonstrate them. And we'll switch hats throughout the presentation in order to give you an idea of who is it that's actually interacting with the website at this current time. It's important to note that each user will only have one role on the website starting in August. So if you are named or nominated as an authorized representative, you may be the authorized representative for multiple plan sponsor accounts. However, you cannot play a different role on the website. We may, as we progress, change this rule. We really have to see how things go. And you'll see with the other roles what their responsibilities are and why we may have done that. I guess one way to think about it is that you know, until Dave sprouts another head, he wouldn't be able to wear two hats at once. So we'll keep it at just one role per user at the start. The authorized representative uses or chooses their account manager outside of RDS, outside of the RDS system. I'll talk more about the account manager in a moment. I think, oh, you might ask, on this slide you'll see that the authorized representative can do everything except for the actuarial attestation and except for starting their plan sponsor account, which might seem kind of strange. And it really has to do with the business model that we were developing under. We assume that that the authorized representative is a high-level person in the company, CFO or something of that nature, and not likely the kind of person who would want to come frequent the website and be actually inputting information for the application, but rather coming back to just certify and sign the plan sponsor agreement. We wanted to make sure that we had more than one person interacting with the application and with the site for a plan sponsor account. So we chose the account manager as the person who will actually set up the plan sponsor account.
And just to add, these user roles are critical to serving some of the key principles that you've heard mentioned here. Flexibility and security. The user roles are very important. We tried to establish a process where in order for an application to actually be fully processed and become an active account, 3 individuals, well, not for the access of the account, but for the application, 3 individuals had to be a part of that. The authorized rep, the account manager, and ultimately an actuary, 1 or more actuaries. So security is very important, and user roles are one way in which we're controlling access to important information.
Okay, I'm now going to talk about the account manager. Change the slide. And I'm going to switch roles, or switch hats with this one, and use this time. It's a perfect fit. In my mind, the account manager is more of the worker bee, or the person who is managing the account and starting the application and doing more work and sort of controlling the whole application process on the website. So as the slide here says, that they will establish the plan sponsor account. They will designate who the authorized rep, they will name the authorized representative initially for that plan sponsor. And again, as I mentioned, that for security reasons, we want the authorized rep and the account manager to be actually 2 different distinct people. We have several, you'll see the data elements that we are collecting, and I think it'll be obvious how we're distinguishing between 2 different users of the website later on. Again, our business model was such that the authorized rep is sort of delegating their application process to the account manager. The account manager may be an employee of the plan sponsor, could be an HR director, HR manager, someone involved in the benefit structures. We also expect that this work may be delegated or farmed out to a consultant outside the company. So it's not a requirement that the account manager actually be an employee of the plan sponsor.
Flexibility.
So the account manager is able to perform all the functions on the application, to submit all parts of the application, again, except for the actuarial attestation, and also except for the plan sponsor signing and certifying the plan sponsor agreement.
We should have had some 70s music going on.
Oh, right.
I'm a little disappointed I can't see myself up on the big screen.
Well, maybe we can change that. I don't know.
No, that's quite all right.
Okay, so the next user role that I'd like to discuss is our qualified actuary. As my bio indicated, I used to work in an actuarial department, so I know that they have a sense of humor. And so we have selected a wizard hat, not for the actuary to perform magic or anything, but just because that they're very smart people who are going to go through that actuarial equivalence, gross and net tests, and sign off and attest to their equivalence to Medicare. So
that's Mr. Potter.
At any rate, the actuaries are designated on each application, and you'll see that process later. You may have just one actuary, as Jim indicated earlier. You may have just one actuary who is attesting to, on your application to your, the equivalence of your plans, or you may have multiple actuaries. They may be employees of the plan sponsor, they may be employees of your insurer, and they may be outside consultants. So again, to be completely flexible, we allowed multiple options for getting your attestations completed on the website. Okay, on to the next. For this one, I was going to use baseball hats for our other designees, but I decided that while we were in Texas that we ought to use a cowboy hat to represent the other designees. Not that they're actually cowboys, but I had to come up with something, and I was running out of ideas.
At least it's white.
Yeah, I did actually think about that. So these other designees are assigned by the authorized rep or the account manager on the application. They are people who might specialize in a certain portion of the application, such as your EFT information, uploading the retiree file, something along those lines. So they have a limited role. They obviously are not able to sign the actuarial attestation or to submit the application and sign the plan sponsor agreement. But the intent is that you're able to delegate some of this work or designate this work to the people who specialize in this information and are more able to complete it for you on your application. It is actually optional. The account manager or authorized rep, once the application is started, could complete the entire thing with their actuary themselves without designees, so it's your choice. I'm going to go back to the hard hat, actually. His hair is going to be a mess at the end of this, so if you would, please. And actually look at registering on the website. I'm going to talk a little bit about starting the process, how it's going to work. First, as I said before, the authorized representative prior to coming to RDS will select their account manager outside of the RDS system. Then the account manager is going to come to our RDS secure website and request their ID, set up the request a plan sponsor account, and designate the authorized rep for that account. Behind the scenes then, in a batch process, the RDS Center will validate the account manager and the plan sponsor information and then send an email back to the account manager letting them know that their login ID has been activated and their plan sponsor account, their first plan sponsor account, has been established. At this time, at the time of making the request, when the account manager comes to the website and makes this request, the authorized rep that they name is also notified via email that this process is being kicked off and started by their account manager. Obviously, they should take a look at that information and make sure that this is indeed their account manager. The authorized rep will receive an invitation then to come and register themselves. They actually don't have to come right away. Once the account manager's login ID has been activated, they may start the application process. So if your CFO is still out on the golf course and not quite ready to come in, you can get started on your application and move the process forward. However, your application cannot be submitted, obviously, until the authorized rep comes to the website. So he or she will do so, request their login ID. Again, a batch process will take place where their login information, personal information is validated and authenticated, and then they're sent an email letting them know that their login ID has been activated. At this point, we have then our account manager starting the application, and I'd like to ask our AV crew if they could switch the screens over to the HTML presentation. Oh, and actually, could you also show the presentation down here on the presentation slides down here on this monitor in front of us? I'm looking back there. I really don't know where they are. But
There we go.
okay.
Also.
And we need to be on the next one. I'd ask at this point, when we were testing this out, we realized that some of the print on the website is kind of small for this sort of presentation, so we decided to put it up on all 4 screens. So I ask that you follow along in your printed information or your copy of the presentation as you go along. I think it'll be fairly obvious as we progress through. Most of the slides are titled with the name of the screen that you'll be looking at. Okay. You will come to the RDS Center website, the public website, rds.cms.hhs.gov, and you will see on the right-hand side of the screen some information in order to allow you to log into the secure website. So the first time as an account manager, and we want this to be the account manager coming here, not the authorized rep, they will come here to click on this link, create a new account manager ID. The account manager will only use this link one time, the very first time, their very first visit to the secure website. In this process, they will create that plan sponsor account and request their login ID, as I mentioned before. They will receive, although the demo is not going to show that today, they will receive a pop-up message that says, are you sure you want to do this? It should be, if you already have your login ID for the secure website, you can just log in on this page and click the login button. The message will also warn you that it should not be the authorized rep performing this function, but rather the account manager. So I'm clicking on that link, and you're presented with this plan sponsor account information page. I'd like to point out a few things about this screen that will be consistent throughout the website. First, on the right-hand side, you see the "You Are Here" sort of navigation through this process. Might look intimidating that it's 6 steps, but you'll see that it's very, it runs through it pretty quickly.
But the last step is thank you. So.
Yes. Well, we're very polite at RDS.
That's right.
Any field on a screen that on the RDS website, you will see an asterisk if it is required. So that's a consistent policy. The information then that you're asked to input here is your EIN. This is your federal employer tax identification number that you would use for tax filing purposes. We need to match the EIN and the name, and so it's important that if your plan sponsor company operates under various different names, please put in the one here that corresponds to that particular EIN. We also realize that many of you have multiple EINs. You just need to pick one that is best suited to this process. You do not need to set up a plan sponsor account for every single one of your EINs unless you choose to do so yourself. We ask for the business telephone, the company homepage just for our own use later on, but that's not a required field. The type of organization. This list is almost complete. We actually are changing some of the values there, but you'll select one of those. That's really just for our statistical reporting purposes, CMS's statistical reporting purposes. We ask for the company address, and then you will see as the account manager here the user agreement. Every user of the website will be asked to read this agreement. We've put it in a box with a scroll bar so that you can scroll through that more easily. You are also able to print this off. And I do want to stress the importance of reading this user agreement. And in order to sign that, you simply need to check the box down at the bottom of the page here and hit the continue button. Oh, I also wanted to point out, actually, that some of the PowerPoint slides that you're looking at may be slightly out of sync with the actual application. We decided to move the user agreement signature a little bit farther up in the process in some cases. So I'm clicking on continue, and I've reached the second step. This is where I, or Dave, as the case may be, as the account manager, is naming my authorized representative for my plan sponsor account. This screen looks a little bit different in the demo than it will look live. What we're doing is making sure that we don't already know this authorized representative. And we're doing that by the email address used. So the account manager will come in and type in an email address here. Click on the Go button in order to search to see if this person is already known to the RDS Center and already has a login ID. If so, we will display their name along with the email address, show that we have found a match, and ask the account manager, is this actually the authorized rep that you intend to use? And you would click on the Accept button. If that's not correct, you could search further, or you could go down and click on the Add New button here to actually add a new authorized representative. Even if you skip that first step, this was just really for your own convenience, even if you skip that first step, we're still going to be checking that email address. At this point, that might be the only information about the authorized rep that we have. So you'll put in the full name of your authorized representative and the email address twice just to make sure that you didn't make a typographical error. And I'd also like to point out something else on the screen or this page that is throughout the website. There are instructions throughout the website for what you need to fill out and that sort of thing. I'll talk a little bit more about quick help and the help features later on in this process. Again, I remind you that this screen will look slightly different depending on what you click on the screen. That's what will actually display. So it'll actually be a little bit easier to use live and in person. So I've input that information for my authorized rep, and I've clicked on the Continue button, and I'm presented now with a screen where it's asking me as the account manager for my personal information. I'd just like to note again, as we're progressing down through the steps, we're highlighting where you are in the process on the right-hand side of the page. So we ask for your full name, your social security number, your date of birth, a job title, telephone, email address, mailing address. You'll put in this information and click on the Continue button. That brings you to the fourth step, and this is where you actually define your own login ID and password for the RDS Secure website. So there are instructions here that give you the criteria for creating your login ID. We're fairly flexible on the login ID. It must be 8 to 15 characters long. Your login ID and password cannot be the same. We're more stringent on your password. It also must be it must be 8 characters in length, combination of letters and numbers, lowercase only. We do not want you to use your name for your password. You cannot use 4 consecutive characters from the previous password as you're changing it throughout your use of the secure website. And your password must be different from the last 6 passwords. So this is pretty standard stuff, really. So we ask that you make up your own login ID, something that's easy for you to remember, and your password, and re-enter your password. We will check to make sure that your login ID is unique on the secure website. So you might find, just like if you go to Yahoo and set up an account, that will come back and tell you that you have to modify your login ID so that it is truly unique. The next thing that we ask you to fill out are the security questions at the bottom of the page here. These questions will be used for questions and answers will be used for several reasons or several purposes. One is to reset your password if you do forget it later on. Another is for those individuals, those users who have to sign or certify on the website a certain part of the application. So the authorized rep and the actuary will actually be asked their security questions and be asked for the answers to their security questions when they're performing that attestation or signature on the plan sponsor agreement. That's what we are referring to as the electronic signature. Don't have to create your own electronic signature purchase any special software for that purpose. You'll see as we go through the process how essentially that will work and how you will be prompted for these answers again.
And to add, CMS's information security requirements are very, very, very strict. We obviously store a lot of very sensitive information, and this program will be no different. So one thing you need to just take note of is I think it's every 60 days passwords expire. So if you're not coming back to the website every day or every week or within that time period, you have to just remember that because of those strict requirements, when you come back, if it has been more than 60 days, you'll have to come up with a new password. And so you may just want to keep tabs on what's going on, come to the website, log in, even if you're not necessarily interacting with an application or something that given day. That might save you some hassle in the long run. If you keep remembering your password. I know that helps me.
Okay, so I've completed this information, and we give you, by the way, questions here to choose from. Favorite beverage, gee, I can't imagine what that might be. After you fill out your answers, we'll store those answers, the question you selected and the answers on our database, actually. Before this information is submitted, you will see a account manager summary page, and this process will work in a similar fashion for the other users of the website. You'll see as we go along. Again, ignore the information that's been posted here. It's just for demonstration purposes. You need to review this information. If you see an error or something that you'd like to change, you can do so by clicking on the edit button. Otherwise, if it all looks good, go ahead and click on the submit button. You will then receive a thank you page where instructions will be given to you about the next steps. At this point, you will exit the website, be actually taken back to our public website homepage, and you will wait for our batch process to complete to authenticate your plan sponsor, EIN and name, your own personal information. Once all that's been activated and we've activated your login ID, you will receive an email. Should take about 1 to 2 days, an email inviting you back, indicating that your login ID has been activated and inviting you back to the website to continue with the process. I think this actually would be the perfect place to take a break, yes. And then we'll come back and start the actual application process here, if that's right.
Works for me. What we're going to do is take our break now. If you would be back here at 10:50. Now, I have an announcement for all CMS regional office personnel are to report to the CMS staff office at the next break. If you do not know where that is, it is out the door to my right, just down where the children's shop is, down that hallway. Also, if you have question and answer cards completed, if you will hand them to the facilitators as you leave, we will reconvene here back at 10:50 a.m. Thank you. Yeah, that looked like a good place.